Here's what I'm seeing. For the past 5 to 10 years, there's been a group of SLPs who've been treating EILO with a holistic approach, focusing more on normalizing the breathing, the respiration, and rather than focusing on the vocal folds per se. Personally, I've seen many patients who did not have success when trying rescue techniques or other techniques, but they did find that their symptoms went away when using a holistic approach. I've also read many articles in the literature that support a connection between dysfunctional breathing, or breathing pattern disorders as we call it, and EILO. If you have access to ASH's perspectives, Dr. Miriam van Mersbergen created a forum dedicated solely to breathing. It's in the December 2025 issue, and its title is Breath Pattern Disorders and Clinical Considerations for Treatment. It has an introduction by Miriam, and there are 5 recent articles or studies related to this topic as well. For full transparency, I am the author of one of the other 5 articles, the article on EILO, but today I want to zero in on the article by Rosalba Courtney. Rosalba Courtney is a pulmonary physiologist and osteopathic physician. She has a PhD on dysfunctional breathing, and she is published widely in the literature. Her article really encapsulates where we, as SLPs, need to be going in terms of how we treat EILO, looking at the whole person, how their breathing affects their vocal folds, and that kind of thing. Rosalba discusses the nature of a unified airway and how dysfunctional breathing is multidimensional, influencing and being influenced by not just the biomechanics of breathing, but also the biochemical and psychophysiological aspects. I believe that the treatment of EILO is going to be looked at more and more from a larger perspective related to dysfunctional breathing as an underlying factor, rather than just focusing on the vocal folds. It means SLPs will be looking at the airway as unified, realizing that how patients breathe in the lower airway impacts the upper airway and that the two really cannot be separated. What can you do now? Well, here are 3 things. 2 of them are diagnostic, 1 is therapeutic. First, consider, we're going to look at the bigger picture in general. So at the eval, ask your patient if they have symptoms of hyperventilation during exercise. The most common in my experience being lightheadedness, numbness or tingling in the extremities, leg heaviness, and visual disturbances. If they do, help them realize that they are most likely breathing in excess of what their body needs or can process for the task at hand. If they don't, their breathing behavior may still be a factor in their EILO. For example, at rest, when they're supine or seated, or maybe both, determine if their breathing is in a staccato kind of pattern or if they're holding their breath for a second after the inhale. Those are things you can look at. Second, ask your patient if they feel they can't get a deep enough breath or if they notice that they're sighing or yawning frequently throughout the day, even when they're not tired. Those are often signs of hyperventilation. And third, for therapy, if you know myofascial release, you may want to consider starting with that in your first therapy session so you can identify and release areas of tension. Thinking about dysfunctional breathing in your EILO or actually ILO patient positions you as a forerunner in our subspecialty area of voice and upper airway. I'm telling you this because, in my opinion, I see this shift coming, and I also see SLPs looking for techniques to be more successful in treating EILO. By the way, SLPs who use a holistic approach for EILO are also finding some of the same techniques to be helpful for voice disorders, ILO, chronic cough, and other conditions. I'm going to put the link to Miriam's article in the description below, and from that article you can look at all the links to the papers and studies that she mentioned. If you want to learn one small component of my holistic approach to treating EILO, click on this video, and I'll see you in the next video.